I started my business was I was very much focused on the client and the patient, as it should be. But then we widened that out to think it's not just about the patient, it's about the care staff and the people who are providing that care.
So we encourage people to come at conferences to ask us questions and to pose us challenges, so to speak, so we can show them and we can work with them as opposed to just showing somebody.
Yeah. Because so when I see how it affects the patient so positively, I want to learn more about how I can do it better. And I think getting care staff away from the idea that it's just organisations trying to save money.
Yeah.
I think that's a big negative. They just want to save money, they just want to cut jobs. But it's not about that. So Debbie, I'm delighted to welcome you to the Martina Tierney podcast. I'm honoured to have you here at Seating Matters headquarters. So could, just for the benefit of those listening today or watching, tell us a little bit about yourself, and then we'll get into how you and I got collaborating. So tell me about yourself.
Okay, so my name is Deborah Harrison. I'm a moving and handling advisor. I work in A1 Risk Solutions. I'm the founder of A1 Risk Solutions, and that's a moving and handling business. And we also provide consultancy, and I just love moving and handling.
And we have collaborated recently, and I think one of the reasons why we are a good match is that you told me one time that even though you're a nurse and still a nurse, that you sort of felt like an OT from very early on. Can you tell me why you felt like an OT and what influence that has had on you in your career?
Yes, quite early on, I realised I wasn't a do and task person when I started nursing. I was constantly saying to people, well, why are we doing that? Because if we didn't do that and we did this instead, that'd have so much better impact on the patient. So looking at the reasons why we did things, looking at the reasons why to make life better and easier for service users, for patients, for the staff that are working in that environment. And that was one of the key things. So I've worked with lots of OTs, over my career. And I can see the similarity and the alignment there.
So rather than going in and just doing a job, you were going in and you were looking at, well, how is this impacting the patient? How is this impacting the client? And looking at maybe alternative ways of doing it. We would call that sort of analysing, the activity analysis sort of thing.
Yes,
So
yes.
that's the OT coming out in you.
It certainly is.
So you're an honorary OT.
Well, and that is quite funny, really, because I was an honorary lecturer at the University of Salford many years ago, and I worked there alongside Joe Webb, who was a clinical researcher, and we did a lot of research articles. And I worked it sounds quite grand being an honorary lecturer, but actually, what that means is you do it as a volunteer, you do it for the love of doing it, and it was so wonderful actually working with the student nurses and helping them see them develop their moving and handling skills and bringing the whole holistic part of occupational therapy into moving and handling really meant something.
Right, very good. So one of the things that we talk about in Seating Matters is, giving the caregivers the means to care. That although in my early days as an OT and when I started my business I was very much focused on the client and the patient, as it should be. But then we widened that out to think it's not just about the patient, it's about the care staff and the people who are providing that care. And I think that's why we are aligned, because that's really the whole ethos of your business, isn't it? Looking at how the person moves someone. So tell us a little bit more about what actually you do within A1 Risk Solutions.
So we deliver training and we deliver lots of different types of moving and handling training. Different formats. So we deliver like a train the trainer program, which is training other trainers how to train. We deliver what we call a single-handed care training program, and we deliver an advanced and diverse complex moving and handling training program. And within each of those programs, we specifically look at we do like a holistic approach. So we don't just train, oh, this is how you move and handle somebody. We get people to consider, okay, what about the psychology of moving somebody? What about the behavioural aspect? What about the environment? So it's more of a holistic
Yeah.
OT approach
Yeah.
that we actually take within the moving and handling.
Yeah.
And like you say, I think that's why we're very much aligned.
Yeah. Just going back to single-handed care, it's a topic now it's something that is very topical now, and it is people maybe get the wrong idea of what single-handed care is. Could you tell me a little bit more about it? And also, you use the term proportionate care. So tell me a little bit about single-handed care, proportionate care, the difference, or how you see it.
It was a term that was used in the beginning to describe reducing care packages, reviewing, reducing care packages. And sometimes, you would review a care package and it'd stay at two people. Or I reviewed 107 cases back in 2006. Yeah, there was a high percentage of them. And we did that whole thing of it was a proper person-centred approach going back in 2006. And it's something that, does happen. But one of the cases I remember in particular, we increased it from one person to two people.
Right.
And then part of the case was two people, part of the case was one person. So not everybody is suitable to use that approach. So single-handed care, it's an idiom. It's a word that doesn't really describe what it is.
You see, what I have found, people that I've talked to, care staff, there's a fear with single-handed care because they think they have to do this on their own. What if someone falls? So there's this fear around it. And so tell me about the benefits of single-handed care and the drawbacks and the importance of doing, like, obviously a risk assessment.
Yeah, so the benefits of, shall we call it proportionate care?
I think it's a better title. Yeah.
Me too.
Yeah.
So
Because single-handed gives people the idea they're doing this completely on their own.
yes,
And, they're not, because it's an assessment, it's a joint, it's like a decision that's made by a team. So they're not on their own. So proportionate care, talk about that. That's a better term, I think.
Yeah, so proportionate care, what that's all about is it's you're going through the same process. You're reviewing the care package and you're deciding whether it's 1, 2, 3, or even 4, and making that so it optimizes everything within the care package. So that could be from the number of carers to the equipment that's required, to changes in the environment, to the skill mix, and providing additional training and support to the carers that are there. And you're quite right, carers are often scared.
Yeah.
Clinicians can sometimes be scared as well. I've met lots and lots of OTs who, until they've actually had the training, who have been quite resistant.
Yeah.
And that resistance comes through lack of knowledge. Sometimes, they've not been exposed to it. So why on earth would you know something that nobody's ever had a conversation about? So the benefits to the patient, if I just start off with that viewpoint, is the benefits to the patient is they get that one-to-one interaction.
Of course.
So you've got that person who's, instead of two people talking over them, you've got one person, and I'm speaking to you and I'm looking you in the eyes and I'm speaking to you. So I was in a nursing home quite recently, and what was really, really nice, I just remember this lady, and it was a dementia setting, and the staff had said to me, she barely expresses herself very well, and she may say 1 or 2 words, and that is normally it. Anyway, I just said to the staff, you stand back and let me take over. And I was talking to her and I was asking her lots of questions about her husband and what activities meant something to her when she was earlier on in her life. And I said to her, so what did you and your husband enjoy doing when you was younger together? And she started, her answers started flowing. And it was really impactful to listen to her. She was talking in full sentences, and she was describing how they used to garden. And then she started giggling and she started laughing. And what she was saying was literally, I said, who was the best gardener? And she said, it was me, because he wasn't very good at growing things. And I just thought that was really,
Yeah.
really impactful. And
Uh-huh.
at the time I had a sore knee and I was busy taking the sling off her. And she'd been, she'd really, really enjoyed the experience. And she leant down and she stroked my face and she said, you're a beautiful young lady. And at which point I thought, oh, well, the staff are right. Maybe there is something wrong with her eyes. And she literally said, do you want a hand up though? Because I can
Oh,
see there's
all
something
right.
wrong with your
Yeah.
knee. And I was like, oh,
Uh,
yeah. So, and the
so
staff were quite
yeah,
taken back with
yeah. So
the
just taking that time with her, and that's a
yeah,
bit of when we wrote this book, The Power of OT. That was one of the things that came out very strongly with OTs. And I'm not saying it doesn't happen with nurses and other professions as well, but it was very evident that the OT always looked at the patient and said, like, what's important to you? What were you good at when you were young? What do you want to do? And that's sort of what you were doing with that patient, making them feel like a person.
yeah,
So, yeah. So I just want to go back to something we were talking earlier, just a few minutes ago there, about single-handed care, proportionate care, the fear element, and, staff not being happy, to bring it on. And I done the training with you
oh yeah,
because I really wanted to find out what it really involved. And what I found was I didn't know about a lot of the new products that were on the market. And I think, is that something when they do the training that they learn about new products, new skills, new techniques that you might not have been applying before you considered saying, or is it just because I haven't done a lot of single-handed care? Is there a lot of new products and benefits there for this?
yeah. There's a lot of new products out there, and
Mm-hmm.
it's the way that we've developed the programs. So, um, as we go out, because we don't just deliver training, we deliver risk assessments. So we'll help out on some very complex assessments, and
Mm-hmm.
we're learning all the time. So myself and my band of OTs,
Mm-hmm.
we, we are going out, and as we go out and do the assessments, we're kind of applying what we teach in the classroom.
Mm-hmm.
And because we've got that benefit of doing that,
Mm-hmm.
we're actually creating new techniques on a, virtually a constant
Yeah.
basis.
Yeah.
So there is a lot of new stuff out there.
Yeah. Yeah. So, two things. First of all, what would you say to somebody who was really scared and resistant to changing over to proportionate care? How
I,
would you reassure them?
yeah, I think it's having that discussion, but actually, I drag them on the training. I encourage them to go to an engagement day. I encourage them to, I mean, people come, to conference,
Mm-hmm.
and often I'll say to them, "Oh, come on, I'll drag them off to a somebody's stand and I'll show them. I'll say, well, it can be done like this." So we
Mm-hmm.
encourage people to come
Mm-hmm.
at conferences to ask us
Mm-hmm.
questions and to pose us
Mm-hmm.
challenges, so to
Mm-hmm.
speak.
Mm-hmm.
So we can show them and we can work with them
Mm-hmm.
as opposed to just showing somebody.
Yeah.
Is kind of like find somebody in your area
Mm-hmm.
or just ask us a question. I
Mm-hmm.
mean, we've got the WhatsApp groups at the moment,
Yeah.
and that's like a community of practice that was
Okay.
originally set up 2023, and that's a great opportunity for people to ask questions.
Yeah. Get support.
Yeah,
Uh-huh.
get support.
Uh-huh.
And what I say to people is, okay, do you know somebody in your local
Mm-hmm.
area
Mm-hmm.
who's good at this? Maybe a colleague, and
Yeah.
so we encourage people to do like learning lunch
Mm-hmm.
boxes.
Mm-hmm.
So maybe bring the equipment reps in.
Mm-hmm.
Ask ourselves. We're
Yeah.
more than happy to support you, guide
Yeah.
you which way to
Yeah.
go. And I know the equipment people, they're more than happy to actually help out with things like learning lunch
Yeah.
boxes and but yeah,
Mm-hmm.
get support from your local area
Yeah.
initially
Mm-hmm.
and maybe go out and buddy up with somebody who knows about it.
Mm-hmm.
And then you can see firsthand how easy it
Yeah.
actually is.
So what I have found, the learning that I've done since I started, working alongside yourself, was the benefit to the patient, especially the dementia patient, overrides the fear that I would have had. Because so when I see how it affects the patient so positively, I want to learn more about how I can do it better. And I think getting care staff away from the idea that it's just organisations trying to save money.
Yeah.
I think that's a big negative. They just want to save money, they just want to cut jobs. But it's not about that. I don't think it's about that. I think it's about, for me, the patient as well and the care staff, that they're doing it in a way that is less dangerous for themselves as well.
Yeah, I mean, you can't get away from the fact that, let's address the elephant in the room,
Hmm.
100%.
Hmm.
You can't get away from the fact that the local councils are saving money
Hmm.
when they do implement this,
Hmm.
but that money is often reinvested into training for staff, which then gives them support.
Hmm.
We advise local councils, we advise NHS organisations what they have to do to set up a strategy
Uh-huh.
to implement it across their ICBs,
Hmm.
and we're more than happy to help anybody, and we'll
Hmm.
offer that advice. It's something that
Hmm.
we just do.
Yeah. So moving on now from single-handed or proportionate care, we're
Yeah.
going to call it now. The other training that you do, just give us a little flavour of the other training packages that you provide.
Yeah, so we deliver Train the Trainer.
Hmm.
So that's a 4-day course,
Hmm.
and delegates attend that, and it equips them. It's like a start on the journey. It's a bit like learning how to drive.
Hmm.
And you've passed your test and off out you go.
Hmm.
So they come on the 4-day course, and they learn about the legislation and how to apply it,
Hmm.
and they learn how to move and handle people in lots of different scenarios, and then it ends up
Hmm.
with
That's not just single-handed care.
no,
That's
it's a
that's
mixture.
that's a mixture.
It's
Yeah.
a mixture,
Hmm.
because what we've got to realise is
Hmm.
not everybody's suitable
Hmm.
for proportionate
Yeah.
care.
Hmm.
And it's I'd like to think it's proportionate care using that approach, the single-handed care approach,
Yeah.
because we are reviewing,
Hmm.
and it's a legal requirement to review people, and I think
Yeah.
it's something that has got forgotten by the wayside by a lot
Hmm.
of organisations.
Hmm.
Um, but yeah, it does equip them, and it equips them and inspires them to
Hmm.
go out there and gives them a bit of fire in the belly.
Yeah.
And off out they
Yeah.
go, and make positive change,
Hmm.
because I remember all them years ago, back in the 1990s, and I did that very course myself.
Uh-huh.
And I just remember trying to persuade my boss at the time. I worked in a nursing home, and I was
Hmm.
trying to persuade him it'd be a good idea for him to send me on it. And I made him all sorts of promises. And I was like, okay, well, I will come back and I'll do all the assessments on all the residents. I'll write us a policy. I'll do X, Y, and Z.
Hmm.
And
Hmm.
anyway, and I did come back and
Uh-huh.
had a lot of fire in my belly,
Uh-huh. Very good.
and then literally then went on to university to study it.
Hmm.
Then
So what other course? So that's the train the
trainer,
trainers. You mentioned another one there.
yeah. So it's called Advanced Level 4. So all of them are ROSPA accredited.
Hmm.
And this one is like the step up. So some people may say it's a refresher. I'm kind of a bit averse to the word refresher, because I think, do you go and have your driving test and
Hmm.
then get a retest on what you already know?
Hmm.
So to me, you should
It's more
advance.
learning. It's
Yeah,
continual learning
yeah,
as
continuum.
opposed to a
It's
refresher.
layering on
Yeah.
what you've
Yeah.
already actually
Hmm. Hmm.
learnt.
Yeah.
Yeah, we did one last week. No, not last week. We did one this week.
Hmm.
And the lady, there was a couple of people that travelled quite a distance.
Uh-huh.
One chap, James, he travelled from Aberdeen and back, so he did an 800-mile round
Goodness.
trip, and he said
Yeah.
it was well worth it.
Uh-huh.
Yeah, so within
Hmm.
that we cover lots of very complex issues. So we'll cover off like the plus size person, how to move and handle the plus size person.
Right.
We'll
Okay.
look at posture management.
Hmm.
We'll look at people with windswept postures, how to move and handle them,
Yeah.
how to maybe get them dressed,
Hmm.
how to maybe feed,
Hmm.
all the different intricacies that
Hmm.
you kind of will look at some research and how to use the tools. So
Hmm.
it's definitely a level up
Yeah.
to, and we like to think, okay, maybe we're prepping them
Hmm.
to be inspired to go on
Hmm.
and do even further
Yeah.
education at university.
So again, just going back to our collaboration between yourself and me, because that very much ties in. Like people will know me as being the seating person, the person who provides and does the assessments, but always knew that how you move someone, how you position someone, their 24-hour posture was all connected to the chair, that you couldn't just do the chair on its own. So I'm delighted to have that, because when you're saying, it's about how you dress someone, how you bathe, how you get someone in and out of the bath onto a share chair, it's all just so connected. to
Yeah.
posture and seating. So we're hoping that together with you and me and maybe some other partners that we will provide that 24-hour posture, moving and handling, seating, do the whole thing together.
That would be amazing.
It would be amazing. A one-stop shop for OTs or care staff or what other disciplines. I want to take you back to the fact that you sort of identify as an OT.
I know, that is so funny.
But also, why do you employ, most of your employees are OTs, and why do you employ them, and what do you see as we say here, the power of OT?
Why do
Why do you employ them, first of all?
Yeah. I think all my friends are OTs. Yeah. They are just wonderful people. They are truly, they look at things with that kaleidoscope view. They look at things, you can turn the kaleidoscope and it goes at different angles. And I've studied ergonomics as well as nursing, as well as patient movement and handling and vocational rehabilitation. So I know I come from a multifaceted viewpoint. And I can see that's how OTs work as well.
Yeah.
So that's one of the reasons I think occupational therapists actually are the best at moving and handling, because they come at it from different angles and they consider lots of things. They don't just consider the moving and handling
It's
aspect.
environment, the patient, everything.
Yeah, I mean, just, what affects the patient's mood, just looking at things like, will a weighted product maybe, calm the person down, and, just little intricacies, looking at, the position of that person's head when they're eating, they're drinking. There's lots and lots of things that we've got to consider in moving and handling. And yeah, that's one of the reasons. I'm not saying wouldn't employ anybody else. But it is one of the reasons that I really do lean towards occupational therapy.
Yeah. Well, the podcasts that we're doing involved in now, they came out of the book The Power of OT, because really the purpose was to inspire and reignite the passion that OTs out there have for their profession, some that have lost it. So it's really good to hear you talking about OTs in a very positive way. So I don't know if I'm putting you on the spot here, Debbie, but can you sum up in a very short sentence what you see as, what's different or what's the power of OT?
To think holistically.
Very good.
Yeah. From lots of different angles, for lots of different people, and to make sure that the person's at the centre of everything that we all want and do for that person and with them.
Well, just to finish off, to say that when we were reviewing the book, it was one of the most used words in the book, holistic.
Yeah.
Nearly every OT used that word. So I think you summed it up very well. So Debbie, thank you so much for being part of the podcast. It's a delight, and I'm looking forward to further collaboration and working with you in the future.
Thank you.